My name is Bronwyn Keefe, and I'm a research associate professor at BU School of Social Work, and I'm also the director of CATER, the Center for Aging and Disability Education and Research, and I'm joined here by many of my colleagues today, which is very exciting. So I'm going to talk about strengthening supports and services for older adults and the role of state policy and workforce training. So why does aging matter? Well, according to the U.S. Census Bureau in 2022, the U.S. population 65 and older was approximately 58 million, 17% of the population. By 2050, it's estimated this number will increase to 82 million, which is more than twice as many as 2000. Despite the growth in the adult population, the American Geriatric Society predicts that by 2030, there will be a shortage of more than 4,000 geriatricians, resulting in limited number of professionals to work with older adults. Further, only 45% of U.S. medical school have some required level of clinical geriatric activity, and only 23% of medical schools have a geriatric clerkship rotation, which BU School of Medicine does, so shout out for BU. So additionally, there are also minimum standards of geriatric education for social work students. So according to the National Association for Social Work, there are 30,000 licensed social workers that are specializing in gerontology. However, it's believed that we need twice as many for that. So since many health and social service professionals who work with older adults are not receiving key training in aging, it really becomes imperative to turn to training the workforce. So, So I'm going to describe a partnership between CATER and the New York State Office for the Aging, which is known as NYSOFA, that highlights the role of state policy in workforce training to strengthen services for older adults. So the goal was to develop and implement a standardized training across 59 community-based agencies who make the Aging Network that employ case managers who provide the skills to better serve older adults in our ever-changing healthcare and long-term services and support environment. The solution was to deliver CATER's competency-based case management certificate program to all state-funded case managers in the Aging Network. The outcome was that NYSOFA created a statewide policy that mandates this training for all case managers in the Aging Network. Written into this policy is that NYSOFA will fund all of this training, and if the case managers have 5 months at the time of hire to complete this, and 5 years they need to recertify. And if they do not do so, the state will withhold funding for these positions. So this policy really ensures that all case managers that are funded through federal and state appropriations receive high-quality, standardized core competency training. This also assures the public, that is older adults, families, caregivers, and other healthcare entities, that the Aging Staff Network are highly trained and are certified through New York and through BU CATER. So some of the impact on the training is that we've trained over 1,100 case managers since 2016. We look annually at training outcomes through pre-post competency assessments, the impact on knowledge and skills, practice change, and overall satisfaction with the program. Each year, we are seeing statistically significant gains in key competency areas, including conducting assessments, identifying resources, providing culturally appropriate and person-centered care, and supporting clients during times of care transitions. Case managers are continually providing positive feedback and indicating that the training is highly applicable to their work. They've also shared how they plan to utilize this certificate program to provide better care to older adults. So some of the implications and outcomes are that this training really highlights the importance of a statewide workforce development program in providing essential skills necessary to deliver high-quality care and services to older adults. This state policy provides a clear understanding of what staff is learning and consistency across the Aging Network, along with assurances to the case manager that case managers in New York are well-trained and prepared to do this work. This partnership also highlights the importance of relationships between academic institutions and state and community-based agencies to expand and strengthen the workforce. This provides an example of how evidence-based research and training can inform state policy and how our impact can be much greater when states commit to policies to strengthen service delivery for older adults, rather than leaving this to the individual agencies to fund and mandate on their own. Thank you very much.